All right, so next we have Amanda Shanks. So you all have known, and we've introduced Amanda several times today or over the weekend as a board member and as someone in charge of our fundraising. And now you'll meet Amanda Shanks, the professional, not just mom, but a counselor. And she gave a talk last year in Cambridge about management and understanding of grief and processing of it. And it was, I think, the most well-received thing that we had to date. So no pressure, but but I'm very much looking forward to having you hear her presentation and having a new look at things. So Amanda Shanks.
Good morning again. You get to hear me talk for a whole 30-45 minutes now, so I'm sorry. But as Dominic said, I'm Amanda Shanks. I know I introduced myself already earlier on today. I am a licensed professional counselor based out of Charlotte, North Carolina. I own my own solo private practice in Charlotte, and I work predominantly with adults who are experiencing generalized depression and anxiety, who are going through general stress management and life transitions. And then I also specialize in reproductive and maternal mental health. So I work with a lot of women in particular, but some men going through struggles with infertility, postpartum depression and anxiety, and also just general adjustment to parenthood as well. And I'm really excited that I was asked to come back and speak. I was thrilled last year when they asked me, because really this is, in my opinion, the one presentation that you will hear. They're all relevant to you guys, but this particular presentation is 100% relevant to you as a parent or as the caregiver. It has a little bit to do with your children, obviously, because you're caregiving, but it's 100% focused on you all. And I was very, very excited last year to present on grief and chronic sorrow, which are those periodic feelings that we all have sometimes of just this realization that life isn't quite what we thought it was going to be. Things are a little bit different than what we had imagined. And they hit us sometimes not necessarily in waves of depression per se or anxiety, but they can feel that way very briefly. You know, when you have a family member who is graduating, and then you think about your own child's graduation, or you see another child walking, and then you think about the fact that your child may not yet be walking, and you get those little pangs, and that's what chronic sorrow is. And so this year, there's so many different things that I could talk to you guys about in regard to caregiving and about your own health. But I decided to kind of focus in on caregiving and relationships, because I think that it is a somewhat overlooked topic when it comes to caregiving, but so critical and so important. So with that said, I do want to give you guys just a little bit of background on caregiving and how it relates just specifically with stress and your own health, and then we'll talk more specifically about how it relates to relationships. You guys probably all know this, but you know, what is caregiving? Let's talk about that first. Just a basic kind of definition is caregiving is the activity or the profession of regularly looking after a child or a sick, elderly, or disabled person. A caregiver could be paid or unpaid, as most are. As a matter of fact, about 70 to 80% of all caregivers, that includes not only for children but also for older adults, are unpaid caregivers. Now, I want to throw this out just to get a little interaction from you guys. I know it's been a long weekend, so I'm going to ask you guys this question. In your roles as caregiver, what are some of the things that you take on? What are some of the things that you take responsibility for and do in your role as a caregiver? It's easier to say what you don't do. That's a fact. Give me some examples. Bathing, medicating, diaper changing, entertaining. Absolutely. Dealing with the outside world and your child. education. Yep. Constant contact with doctors, with therapists, educating doctors and therapists. Okay. Yes, all of the logistics, managing schools, managing legalities, managing doctor's appointments, handling finances. Yep. Keeping our kids safe. Yep. Anything else? Yes, putting out fires. You're on call, right, as a caregiver 24/7. Yep, that's right. And it doesn't end. Anything else? Those are all great. I mean, these I feel like are kind of a general summation of some of the roles of caregiver, and you guys pretty much nailed most of them. You are providing emotional support, you're providing physical assistance, you're providing medical care, you're coordinating all of the logistics of that. You're taking up a tremendous amount of time, which we'll touch on in just a little bit as well, to make sure that all of these needs are fulfilled. You're providing financial support, housing, meals. You're providing transportation to and from appointments. All of that takes time. You're on call for emergencies. And you also have to deal with all of the legalities of what's involved in the systems, the logistical issues as well. Some general stats about caregiving that I just think are particularly interesting for our group are caregivers or children are much more likely to be the sole unpaid caregiver than our caregivers of adults. About 80%, it's probably even a smidge more, honestly, of all caregivers for children are unpaid caregivers. There's very little extra support that is given in many cultures, not just the U.S., for caregivers, so most remain unpaid. About 54% of caregivers of children do say that someone else helps them sometimes with caregiving on an unpaid basis, but that's significantly less than it is for those that are caregiving for the elderly and for older adults. It's about 68% with that. And most people who are caregiving for older adults also have some paid caregiving help as well, whether that's in the form of, nurses coming in for hospice, for example, and things like that, or CNAs that come in and help with basic ADLs. And whereas for children, it is predominantly on the parents and they are unpaid. Also, I think it's significant to note that we spend a lot of time in caregiving. Most of the time for children, the average is about 29.7 hours per week. That's 11 more hours than caregivers of adults. And also, about 1 in 4 provide 41 hours or more. And I know that we have some people in this room who you're the full-time caregiver. That is what you do. That is what your job is. Most caregivers of children are female. And also there is a significant financial impact. Informal caregivers usually personally lose up to about $650,000 or more over a lifetime, as well as loss in Social Security benefits, loss in pension benefits, and also wages that are lost due to missed work or having to rearrange a work schedule. So, needless to say, that leads to a little bit of stress. Stress and caregiving kind of go hand in hand. It is definitely been heavily researched, and generally speaking, caregivers tend to be a little more stressed than the average person. They're dealing with a lot. Not only are you managing all of those roles, but that takes a tremendous emotional toll on each and every one of us. We face a lot of uncertainty about the future. There are a lot of things that are very unpredictable and out of our control. We don't know when our children are going to have a medical condition or when they need to go to the hospital, or we don't know when our children may regress. We don't know when they're going to be doing well. It's very difficult to plan. It's very difficult to know what is going to be coming up moving forward. A lot of us have made some significant changes in lifestyle as a result of our child's condition. Maybe we don't go out as much, we don't spend as much time with friends, we don't spend as much money out doing things, and there have been some significant adjustments and shifts that we've had to make. There's financial burdens. There can sometimes come along with that some isolation and changes in your relationships and the dynamics of those relationships. And it's hard work. It takes a physical toll to, lift a child in and out of a bathtub and do a transfer from the bed into a chair. There's some significant challenges that we all face as a part of caregiving that kind of span every area of life. The greatest factors, according to the research, that kind of exert the greatest influence on caregiver stress are, first of all, the age of the caregiver. Older caregivers tend to generally face a bit more stress in general. I imagine that is because you're dealing typically with an older child at that point. The physical demands are much higher. Your own end-of-life questions and issues begin to come into full force and effect, and you start to think very heavily about what Mr. Shepard was just talking about, and are you prepared for what happens when you're no longer here? So I think that the burdens on older caregivers are very significant. The second is time spent on caregiving. The more you caregive and the less that you allow time for breaks and time for to really focus in on yourself, the higher the stress levels. And also the expenses. And we all know that it can get quite expensive. Two of the things that I want to touch on are how caregiving affects physical health and then also how it affects your mental health. And the effect of caregiving on physical health is pretty astonishing, actually. Many research studies have shown that, generally speaking, the physical health of caregivers tends to suffer a little bit more. There are probably a multitude of reasons for that. One is the physical demands of caregiving, and then also the fact that you're spending so much time in caregiving that it's hard to take care of yourself physically. It's hard to carve out time for exercise, to cook, to kind of properly nourish your body and take care of it. As a result, 70% of mothers of children with physical disabilities have low back pain. Caregivers also report higher incidences of migraine headaches, GI ulcers, and also chronic illness. One study was done and reported that up to 50% of caregivers reported having a chronic illness. So I think that statistic is pretty significant. As far as the effects of caregiving on mental health, there has been very surprisingly little research done. It shouldn't surprise you guys. We all know the caregivers are usually, we're kind of the afterthought, right? Like we're the ones that are kind of lower on the totem pole to be studied. So it kind of makes sense. And some of the research that's out there is a little bit conflicting. But generally speaking, several studies have indicated higher scores on the Beck Depression Inventory compared to control groups, although generally they're only just mildly elevated compared to the general public. And several studies have also indicated that depression is usually significantly elevated when a caregiver is struggling with a child who has behavioral or emotional concerns as well. And that is also pretty tied with, and this will make a lot of sense, I think, to each of you, if your child is sick or not doing well or in the hospital, your stress levels are going to spike at that time as well. There's a pretty significant difference between men and women when it comes to mental health and stress and caregiving, and that is because, as you remember, about 70% of caregivers, primary caregivers, are women. Several studies have indicated that depression is much more common in mothers than in fathers. Very few studies have included fathers, but those that have seen a pretty significant difference. This is probably in large part because of the fact that most women are taking on that primary caregiver role. They are taking on the practical work. They are making adjustments to their work schedule. They are making adjustments to their social life. They are putting their health second. Not to say that you men don't do it either. I'm not trying to say that, but I think that the burden falls predominantly on women most of the time. It is also possible that fathers might demonstrate their distress and their emotions in a different way. So, just to kind of take a look, and I tried to be as culturally relevant with this statistic as I could, so there's a little bit of a wide range. The lifetime prevalence of just specifically depressive and anxiety disorders vary pretty widely between cultures. It can be anywhere, depending on the culture, from about 3% to 17% in the general population. And among caregivers, it's still a pretty wide range, and you can see that it is just slightly elevated. It's not a huge difference, but you go from 3% to 8% on the lower end and 17 to 20% on that upper end. So there definitely is an increased chance and kind of risk as a result of that stress from caregiving that you might experience a depressive disorder and anxiety disorder as a result of that. There are also, though, some positive aspects of caregiving. I'm sure you guys can tell me a couple of those as well, but some of them are you develop extreme feelings of affection and closeness with the person that you're caregiving for. You can derive lots of personal satisfaction from caregiving as well. It can provide a lot of purpose and meaning for your life. It can really open your eyes, broaden your horizons, your perspectives, challenge the thoughts that you have had about people with disabilities. It can also increase family members' closeness and cohesion, and also their awareness of what you can handle in this life. I think that that's a really powerful thing to take away from caregiving, is realizing that you can do this, And it also encourages connections and community groups. So, how does all of this impact relationships? Specifically, how does caregiving impact relationships? And then we'll look at the reverse of that. Well, as I mentioned earlier, caregiving takes up a lot of time. And that means that that's time away from your romantic partner, that's time away from your friends, that could be time away from work, it could be time away from school, it could be time away from friendships. It's extremely time consuming. As a result of that, sometimes intimacy can be lost. It takes a physical toll, so you're more tired and you may not want to engage with your partner or with your friends. And there's an emotional toll. And not to mention, if you are in a romantic relationship, your partner might feel the exact same way you do. They could be burnt out. They could feel angry. They could feel stressed. They could be overwhelmed as well. So sometimes you have both partners feeling very similarly and not knowing how to both take care of themselves and connect intimately. So a few stats on caregiving and relationships that I also think are pretty interesting. 6 out of 10 caregivers of children say their caregiving limits the amount of time they spend with other family and friends. It's a pretty high statistic, I think, and it could be even higher. 7 in 10 caregivers indicate that they were employed at one time while caregiving, so that's 70%. Just over half are currently employed, according to a study that was done in 2012. So that's a pretty significant, almost 20% of those people dropped out of the workforce, essentially, after beginning caregiving. It's a pretty significant statistic when you think about it. And when you look at just kind of the general adult civilian population, it's about 64%. So it's a pretty big difference there. And 3 out of 4 caregivers report making some type of change to their work situation as a result of caregiving. So it definitely significantly impacts your ability to work and your ability to work a normal schedule. Also, about 40% of caregivers reported experiencing activity limitations, and of course there's the 50% that reported experiencing chronic illness. So that has a pretty significant impact on relationships. There is quite a bit of research, especially more recent research, on romantic relationships that's very conflicting, but I'm going to tell you guys about it anyway. In 2015, a very large longitudinal study was done. This is the most recent one that's been published and done, examining the risk of divorce, and it compared 190 parents of children with developmental disabilities, and it compared it to well over 7,000 parents of children without disabilities. It studied them for over 50 years, and it was actually quite encouraging when it comes to romantic relationships. It really didn't find any significant differences between the groups who just had one child, and actually the kind of control group, the group that does not have children with disabilities, had a higher rate of divorce when a second child was born compared to those parents who had children with a disability. This kind of flew in the face of the study that Mark actually referenced earlier that has been done that indicates about 80% of all parents who have a child with a disability will get a divorce. This is very conflicting, and there are a couple of other studies that also kind of conflict with that as well. There was one done in 2003 that just kind of indicated a slightly elevated risk of divorce and separation. And then there was another study done specifically with parents of children with Down syndrome that actually said the rates of divorce were lower for them than for the general public. So there's a lot to kind of look into and say, well, why is this and what's going on here? One of the things that they have identified, though, are that there do seem to be some specific predictors of separation and divorce, some things that maybe put you at a higher risk of it. Some of those are having a child who has an emotional or behavioral disorder. I already mentioned that caregiving for a child with an emotional or behavioral disorder bumps up the stress level for you 10 times, basically. Also, a younger parent age and a lower level of education is a predictor, as well as depression. A parent's depressive symptoms are a high risk factor for divorce. Low household income, as well as other general family disturbances, which we'll talk a little bit more about that in a second. So on the flip side of that, we just talked about how caregiving impacts relationships, but now I want to talk about how relationships impact caregiving, and there's a distinct difference there. Very positive difference, actually. Generally speaking, individuals who feel really well connected are better able to cope. They're less prone to anxiety and depression, and they have better overall physical health. I hope y'all heard that after all of that stuff that I just gave you about stress and mental health and your physical health, that having social connections has been empirically shown to improve your ability to cope, to lessen depression and anxiety, and to improve your overall physical health. Just that one thing right there. Social connections have been associated with lower disease incidence, as well as faster recovery in disease, and low sense of social connection and negative social interactions have led to an increase in psychological distress and low self-esteem. So basically, kind of the summation of that is that positive social interactions have a stress buffering effect. They make it much easier for you to manage and navigate stress, whereas negative social interactions have the exact opposite effect. You're going to see an increase in your stress levels, and it's going to exacerbate any stress that may be going on in your life. So with that being said, I put together a couple of tips, just 3, for improving your social connectedness. The first one, it's going to seem cliche to all of you guys, I just know it as a caregiver, is take care of yourself. You may not hear it all that often, or you may hear it all the time, depending on who's around you. But it's incredibly important for each and every one of you to take the time to take care of yourself, to allow time to focus on getting enough sleep, eating well, exercising regularly, doing something that you enjoy, limiting consumption of alcohol, which some of us might have failed at the last 2 nights in the bar. I don't know. That's okay. It's very important that you kind of take care of the basics. When you feel, generally speaking, that your stress levels are better, it has a positive impact on your social relationships as well. You're not carrying that into those relationships with you. Another piece of this that isn't so much kind of the practical taking care of yourself is learning how to adjust your mindset. Easier said than done, I know sometimes, but adopting a can-do attitude, it can be really important. Not so much like I can do anything, but more so, okay, today is a day that I do have some sense of control over. What can I do today that's going to make an impact for me, for my family, for my child, and focusing on those very small daily tasks, taking it kind of each day at a time. Also intentionally focusing on the positive aspects of your life. Generally speaking, just because you are a caregiver, those things don't disappear. They may change and they may shift, like we've been talking about, but they don't necessarily disappear. So being intentional and focusing on them can be really powerful. And also finding your own meaning in caregiving can be incredibly valuable. That can take a lot of different looks for different individuals. What I find meaningful in caregiving may be very different than each one of you in this room. But being able to find a sense of meaning and purpose in what you're doing day in and day out, especially given what we've talked about with how much time you're spending caregiving, is really critical. So I put together this just little list. It's nothing fancy, but just a kind of 10 tips for reducing caregiver stress. Learning how to accept help, prioritizing, setting realistic goals, finding resources in your community, finding a support group, getting social support from family and friends, maintaining your health, use your doctor as a resource, make sure you get the appreciation you need, and also take a vacation. Use your respite care if you need it. It's not an exhaustive list, and let's be real, are you going to be able to do all 10 of these things every single day? Probably not, but I think being mindful of taking that time for yourself and kind of focusing in on these different areas is really critical and really important. If you're kind of struggling with that or not sure where to start, or if you do feel like you may be one of those people who the stress has become really overwhelming and you suspect that maybe it has kind of lingered into some depression and anxiety, I think it is really critical that you seek professional help. Find someone that you feel comfortable talking with who will take the time to listen to you, where you can go, every week, every other week, once a month, and just talk with them, have that connection there, get that reassurance, and kind of get that feedback that you need to be able to move forward. So the second tip for fostering connectedness is to be very intentional about seeking out and fostering positive interpersonal relationships. Notice that I put positive in bold up there. That could be just enhancing the relationships that you already have, taking time to talk with your friends and your family members. Generally speaking, they want to be involved. They may all have their own ways of expressing their support to you. Some people are great at bringing you a meal when you've come home from the hospital. Other people are your great listening ear. And one example that I gave at the conference last year is, there may be other people who aren't so great at that, but if you need a wheelchair ramp built, they're going to be there. So kind of knowing who you can turn to for that support and making sure to include them in what's going on in your life is really important. This is also, as a part of caregiving, a great opportunity to develop new social networks. That could be either with friends and being intentional about setting up things, whether it's a Sunday dinner with family, whether it's a once-a-month book club, whether it's a running club, or it could be very specific to caregiving. And I'll give a personal example, but in Charlotte, we have started a group that is very specific for rare diseases in the Charlotte area. And it's been fantastic to connect with other families, none of which who have PURA syndrome, but all of which can relate to some degree because all of their children that they're caregiving for have a rare disease as well. And that's been incredibly powerful and very meaningful for all of us to be able to have people in our area that we can turn to, that we can talk to, who understand what's going on. Another thing that you can do, and this is directly related to your child, is truly allowing time for positive experiences with your child. I mean things that don't involve therapy and medical appointments. Allowing time to talk, to go do something that you know your child enjoys, to be able to focus in on them away from therapy and away from medical care. So many of us as caregivers can get so overwhelmed with all of the laundry list of to-dos. Oh, I've got to work with her on standing. Oh, I've got to get her out of the chair and put her in this brace. Oh, I've got to, of course you've got to give her medicine, but we've got to be back at this time to give medicine. We've got to do this, we've got to do that. And then you lose sight of that relationship with your child. And so really being able to just stop, even if it's for 5 minutes, and just be one-on-one with your child where you're not working with them on something, you're just being with them, is incredibly important as well. And it's hard, and I know that it is. So if you are in a romantic relationship, I think it's incredibly important that you prioritize that relationship together. It's hard, but take time to communicate. Take time to go on dates. Take time to do things that you enjoy together. They don't have to be expensive, or they can be, whichever you prefer. But just making that time to strengthen your relationship is incredibly important. The last thing, and it's probably the hardest thing actually, is learn to set boundaries. This can look a lot of different ways for caregivers, but it is imperative that you all learn to assert yourselves. That can be in simply learning how to ask for help, or better yet, just saying yes when help is offered on its own and being okay with that. Saying, I will accept that. Yes, thank you. And then it's also about learning how to say no to certain things. And that includes in our social relationships. I'm sure some of you might have that friend who's great. They want to hang out with you all the time, but you can't. You have to say no to them sometimes. You don't have the time and the capacity to be with them as you were before you were a caregiver. And learning how to say no and to still maintain that relationship is incredibly important. It's also really, really important for you to learn how to be clear with friends and family. When you've had a really rough month in particular or something like that, maybe you don't want to go out. Maybe you want to have people over to your house. Maybe just someone bringing a coffee and just sitting and talking on your couch is all you need. Or maybe you're ready to break free and you need to go see a movie and you need to go to dinner and you need to be out of the house, But being very clear with friends and family about what kinds of social interactions are going to work for you, especially now that you've taken on this role as a caregiver, is really, really critical. I imagine that for each of you, most of your friends want to support you, but they may not know exactly what it is that you need. They may not know how they can best support you. They may not know how they can help. So being clear with them provides them the opportunity to respond and to really build that relationship. The other thing that can sometimes be kind of challenging is if you do feel like there's a relationship that's particularly unhealthy or negative for you, you may want to look at eliminating or limiting the ways that you spend time with that particular individual. I do kind of want to go back to that what the research has shown is that positive social interactions have the stress buffering effect. Negative social interactions exacerbate it. They make it worse. And so if you're feeling like you have a relationship like that in your life, that may be something worth exploring. And if you're not really sure how to do that, once again, I think personally, since I am one, I think talking with a professional is always particularly helpful in that scenario. It can really help bring some clarity to a situation and help you kind of get a clear sense of where you want to go moving forward. And that's about all I have for you guys on caregiving and relationships.